So why is our call for the public sector to be more purpose-led, collaborative and adaptive particularly relevant to central government in the UK? This year, central government has managed a huge transformation programme that has touched the lives of millions of people in the UK. We've seen departments galvanise to deliver an agile response to the biggest disruptor for many, many years, COVID-19. Sense of purpose has always been strong in the public sector, with many staff attracted by the opportunity to deliver real-world outcomes. Things they really believe will make a difference to society and the environment. Pandemic has raised the profile of how national infrastructure supports families and individuals, creating that sense of purpose even more clearly. Through our work with public and private sector, we know that where employees really believe in the sense of purpose for the organisation they work for, they become more engaged and more productive. We also know that corporate social responsibility and impact on the environment is becoming more important to workforces. They want to know that their organisation is both socially and environmentally responsible. So we think that central government should capitalise on the profile that they have gained through the COVID-19 pandemic and build on it even further. An example of where I have seen government organisations work in a collaborative, adaptable and purpose-led way is with two clients that I worked with jointly before the pandemic. The outcome of the work that we did came into its own during the pandemic. I worked with a very forward-thinking government department who had made the conscious decision to partner with an NHS organisation in order to respond to the increasing demand that they were seeing. They weren't able to increase the supply or the amount of workers that they had, but they needed to be able to respond to this demand so that they could care for people appropriately. The organisation created a partnership agreement, new governance, new roles, and changed their ways of working so that their staff would go out in multidisciplinary teams together, delivering care in the community and enabling patients to come home more quickly, which delivers better patient outcomes. The result of this work was not only that patients had better patient outcomes, it was also that hospitals had beds freed more quickly, so there was more space in the acutes. Through the reform agenda, now is the time for government to maximise workforce fluidity and translate the department's successes into new ways of working. To manage talent in central government as one whole workforce, matching capabilities to needs and responding to changing agendas as we continue to respond to the pandemic and we re-engineer our infrastructure so that it's appropriate once we stand separately from the EU. It's time for central government to capitalise on their profile as the employer of choice for those that care passionately about societal and environmental needs, actively attracting more talent than ever before to deliver these complex agendas.